I chose it wisely, and then I read it, and then I got to know that I was chosen for this. Then I got to know that he's a high-SNS person. He don't trust doctors. He want to get operated, but the time he used to look at his face, he used to think, "Oh my God, what is he going to do to me for money?" Even in the middle of the night, somebody will tell me, "Nah, this there's a case. You want to do it?" I'll just wake up and I'll say, "Yes, I'm ready." But if somebody is going to ask me for water, I won't wake up.
Hello, dear friends, homeopaths. My name is Barbara Liberowicz. This is Homeo Sapiens, and my guest today is Dr. Mini Meta. We met at Utrecht Liga Congress in May this year, and later Mini presented her case of endometriosis. I guess your professional career is quite different from my career, from average homeopathic European doctor career. I know you have different educational system.
When I was in class 10, I chose to be a doctor, so I opted for medical stream. So I read physics, chemistry, biology. Then after 12th, I gave entrance exams for various medical courses. So my first choice was only conventional medicine because by that time only I knew only one kind of medicine. So, but I wanted to have that course in my city, but I could not get through. So I appeared for the entrance exam of BHMS, Bachelor of Homeopathic Medicine and Surgery, and I got through it. So my university was Guru Gobind Singh IP University in Delhi. I always wanted to become a doctor, a good doctor. So I thought, why not alternative system medicine and choose it? I chose it wisely, and then I read it, and then I got to know that I was chosen for this. So this is a 5.5 year course in India, in which first 3 years we just read all the subjects like anatomy, physiology, pathology, and microbiology, along with the homeopathic subjects like homeopathic pharmacology and organ of medicine, materia medica. And after fourth year, we get our internship in peripheral OPDs in different, small towns and villages where every day we see patients, we make records of it, then we prepare a thesis at the end of it, presenting our favorite topic. I prepared my thesis on osteoarthritis, where we present 20 cases, where how we treated, how many cases we repertorize, on what basis, on what indication, and then this is how we complete our course over here. When I was in my last 2 years of BHMS, at that time, I joined a senior homeopath, Dr. Bimal Gosai, at his clinic. He was a guest lecturer at our college, and I used to appreciate his case studies, so I joined him at his clinic for 2 good years, where I used to assist him. I used to understand how he was treating so many, you can name incurable diseases beautifully with homeopathy.
And then you were a young doctor, you had your diploma, you were proud, and then what happened?
And I wanted to be more sure, so I got in contact with a cardiologist, allopathic cardiologist, who used to favor alternative medicine and who was interested in homeopathy. So I joined him to treat pre-surgical conditions and post-surgical conditions in cardiac patients. So I used to be in his OPD in the morning and see patients. And he used to take me to his IPD patients as well, where he used to show me patients. He used to tell me, Minnie, look, now the time we'll enter this patient's room, I want to operate on him, but his BP is going to rise. The time he'll look at my face, his BP is going to rise. Can you treat him? Can you treat this person? Can you think of some medicine for him? Because I know all the mother tinctures, but you homeopaths, trained homeopaths are good at picking up the constitutional medicine. I know he needs a constitutional medicine, but I think you can do it right. Then I took a case. I asked few questions to him, and I saw his BP rising also. Then I got to know that he's a high SNS person. He don't trust doctors. he want to get operated, but the time he used to look at his face, he used to think, "Oh my God, what is he going to do to me for money?" So when I gave him high SMS, after that he improved. His reactions were more controlled, and they could operate on him. And post-surgical healing was also very good. So with him, I learned where I can start with. He told me that how good beta blockers and ACE inhibitors we have in homeopathy. Like our Cretigas is a very good ACE inhibitor, better than the allopathic ACE inhibitor. Our Lycopus is a better beta blocker. So with him, working with him, I got to know how I can replace the allopathic ACE inhibitor and beta blocker with our homeopathic ACE inhibitor and beta blocker.
So you became young doctor, enthusiastic, and you got your post in the hospital. And what happened next?
Then I did a lot of work. I treated a lot of patients with homeopathy, and homeopathy was drawing me more and more into it. And my confidence was rising because I was working, I told you, under the supervision of a, allopathic doctor.
Tell me exactly, because I don't understand exactly how it is organized the work. So you are working at the allopathic department where allopathic doctors work, and you give additional homeopathic care to the patients.
I'll explain. I work in a regular hospital, and in India, all hospitals can have an Ayush department where they can have consultation room for Ayurvedic doctors, homeopathic doctors, Unani doctors, and yoga doctors. Okay, they have a facility, a separate building consultation room. Similarly, in a cancer hospital in New Delhi, Rajiv Gandhi Cancer Hospital, I have a consultation room, which is a homeopathic palliative care in the with the name of. So where all the other specialists, they refer patients to me. So many good doctors in our hospital. The neurosurgeon, he used to take me with him when he used to go for the rounds. Post operative, after operating on some patient for glioblastoma multiforme, the patient was unable to open eyes. And then the way patient was lying and snoring and everything, I prescribed opium, and he woke up. So he liked that homeopathy works like this. So every time he used to take me, and then one time I saw one patient. I said this patient needs stramonium. The cheeks were red and everything, and that patient also woke up early. Now these patients, when they go to the hospital in emergency, also they give me a call. Call first, call Mini ma'am. We want to know whether we should go for this, what they're suggesting or not. There was one patient, she was post-surgical case of breast cancer, but she was having some medicine. She got urine retention, very bad urine retention, and then they brought her here and they were trying to help her through catheterization also. But when I went, I saw her puffiness on the face and everything. I gave her apis and she was better and she passed urine. Sometimes, some patients were with severe pain in the head. Brinia 1M 3 doses, the pain was to 30%. Otherwise, on the basis of that pain, he could be referred for surgery, because he had some tumor. The recurrence of the tumor, they don't want to open it again.
I think your work in the hospital is quite different from what we are used to from European hospitals, because from what you told me, you face challenges, and you don't hesitate to take these challenges with homeopathic treatment.
Yes, yes. Even I just tell people, whenever somebody tells you that you cannot improve beyond this, just contact me. And I used to tell all my, doctors there, allopathic doctors, please send me your rejected cases. Please send me your rejected cases. Maybe I'll do something for them.
I remember in Utrecht you told us the first case you treated when you started your work in the hospital.
I'll tell you, when I joined the hospital, I was placed with a palliative pain management doctor. She was 2, 3 years younger than me, but much more higher. She was MBBS and pain specialist, and I was a simple, humble person, and he had a big ego, and he never liked us so because he was different. Then I used to ask, send me your rejected cases. Then one day she told me, you want to work? I'll give you a good case. Come with me. So I went with her and she referred me a case. A patient was lying in, coma and just looking around like this, moving eyes. And she told me he has been operated 4 5 times. And this time post radiation, he's like this. He has frog legs. He has very bad contracted limbs, and we were trying to straighten them up by tying and giving lot of medicine, but nothing is happening. He has just lost it. We put food in his mouth. He can't even chew. He keeps it for longer time in his mouth. So do magic, do homeopathy. I thought, what can I do, man? This is almost dead. So, but still, I said, okay, let's do something. Let's at least take a case. So, from his son, I started taking a case, how it happened, how it started. It started 10 years back, and what was his behavior, what was nature. The time I was asking questions to his son, I could see that man looking at me, so staring at me when I was asking questions, and lot of things I got to know about him. I got to know he was a Nakswamika personality, the way the son was narrating the case. And that time, whenever, like I asked, what he used to relish more, spicy, salty, and then the son said green chili. And he just looked at me and confirming, yes. But he was not very, he was, I was somehow feeling that he's looking down upon me, what will she do? Just a homeopath and that to a girl. Oh, why she's wasting time? But then I read, they told me the time they used to suddenly, slowly touch him, he used to get shivers. So, and if they used to touch him strongly with firm hands, suddenly, then it was fine. Otherwise, he used to get shivers and so many other things. There were a lot of symptoms matching to Nux vomica. I started with LM potency, Nux vomica 0/1. And I told his son to give it 4 times a day. And after a week, I saw him, his bed was up and he was watching TV. He could focus at the TV. And then they told me, I asked his son ki how much he has improved. He said, ma'am, he has improved a lot. Now he can chew. Otherwise, I used to put bites in his mouth. He could not do anything. Now he chews and swallows. But he keeps on staring, nothing else. He's not moving limbs at all. And then I continued till Nakswamika 6, and he was fine. He was discharged. Then I read more and more, and then I read about plumbum iode, which is a very, very good medicine for that. I'm telling you, I was not having that medicine in LM potency, and I ordered for that. I was not getting it. So I sent one dose. I sent one dose, and one leg was straightened up after 3 days. He could straighten. He was sleeping with one leg. Earlier, the legs were like this, feet were like this. One leg could he could open that, and then he could ask for the switch of the fan by his actions and everything. He was improving. The next week, I gave another dose along Naxwamika. I was continuing. I could not dare to stop it. I was not that confident, so I could not stop what created everything, started everything. And then we continued the weekly dosage, and then he was sitting on the chair, sipping his tea, and he lived for next 9 months. A lot of part of his brain was removed during the surgeries. And then that time, my neurosurgeon, he said, I don't know how this person is sitting. So this is energy, this is homeopathy, this is how we treat the person in disease.
We also met online when Dr. Asher Sheikh presented his case treated with combined New German medicine and homeopathy. And you mentioned you also apply New German medicine in your practice.
Yes, I read German New Medicine because I'm very curious and I want to know everything which is in the favor of the suffering humanity. So I don't want to leave any stone unturned. So when I read it, then I understood that there's so many sudden unpredictable conflicts when we face them. that creates a sudden change, conflict resolving thing in our body, in which first we start suffering and the symptoms are different, and in the second phase it is the healing phase, and most of us are hanging in the healing phase, hanging healing phase. So what are the symptoms there, and there are the reasons for that, and different type of worries cause different type of hormone changes. I read it, I had that information in my mind. So when I started taking cases in the this allopathic cancer center, like a lady came to me with left-sided breast cancer. So while I was taking the general symptoms, the pathology, I used to ask them, suddenly, do you suffer with some grief from your somebody younger in your family, some child or mother? How do you know my younger child is suffering from this mental disease? And then I used to ask more and more, and number of times as I was asking like that, they used to ask me, "Do you know us?" So all of them were related some or the other way to that particular kind of conflict. I met one boy, he was suffering from testicle cancer, and suddenly he was diagnosed with that. And in the history, I got to know that he never got married to the girl whom he loved because of some conflict in the family, and that girl got married to somebody else. Now he had to get married to somebody else. And from the day of the first night, he suffered the swelling. So there were so many things. So, totally directly, there was a man who was suffering from lung cancer, and he was just biopsy was done, and they were sent to me. So I took the case. He told me, he was a teacher. I said, "What is there in you? Is there some grief you suffered suddenly, which you thought it should not have happened? Is the major thing in your life you think it should not have happened?" And he said, "Yes, ma'am, I got my daughter engaged with a very good boy having a government job, but somehow this engagement got broken. And now we have a bad name, and what would my daughter do?" Then I make in GNM, they say if you make the patient understand that what triggered his disease, that starts the healing. Used to make him understand that this sudden conflict in your life has generated this thing in your lung. And on the basis of that loss, I gave him Ignatia. I started with Ignatia, and he told me after biopsy he did not take any treatment from there, and he is doing fine.
What was his histopathology? Was it just tumor or was it confirmed cancer?
It was confirmed cancer, small cell.
I found that Ignatia is often a remedy for cancer, and I didn't, in my earlier years, I was thinking, okay, Ignatia is a superficial remedy for some, emotional problems, but then I had more and more deep diseases cured with Ignatia.
Even in the middle of the night, somebody will tell me, "Nah, there's a case. You want to do it?" I'll just wake up and I'll say, "Yes, I'm ready." But if somebody is going to ask me for water, I won't wake up.